Good evening from New York. If it were up to Senator Max Baucus, middle-class families would be forced, literally forced, to pay far more on health care than they already do right now. 13% of what they make could be deducted directly from their paychecks and mainlined to insurance companies, a so-called max tax that would be handed over to the very industry that has given the chairman of the Senate Finance Committee $3 million in campaign donations. And that 13% payroll deduction does not count co-pays and deductibles. See a doctor for any reason or get sick, and you can expect to pay nearly $12,000 a year more. Our fifth story in the countdown, only $3 million to Chairman Baucus in exchange for a bill in which the health insurance industry is guaranteed to make billions upon billions? We know what you are, Senator Baucus. We're now arguing about the price. Mr. Baucus today releasing his version of the health care reform bill that would give coverage to 30 million Americans who currently do not have any. First, by extending Medicaid, the state federal insurance program for the poor. Next, by providing government subsidies to modest income families and individuals to help them buy over-the-counter coverage. Only those who make less than 300% of the poverty level would fall into either of those categories. That means any individual making more than $32,500 or any family of four making more than $66,150 is on their own subject to the max tax of 13%. For a family of $66,700 or $66,000, that is $700 a month they'd have to pay. If the families do not buy that insurance at that rate, they would be fined nearly half that amount. Some other nuggets in the Baucus bill: private insurers would be allowed to charge older individuals up to 5 times as much for coverage. You heard that right, 5 times. Forget about pulling the plug on Grandma. Max Baucus wants to help the insurance industry steal her purse. Also in the bill, anyone with pre-existing conditions would go into a high-risk pool, but the provision says they would need to be uninsured for 6 months before they could even gain access to that pool. Exactly what you want for those who are already sick. And yet the Republicans on the Senate Finance Committee continue to distance themselves from the mess they helped to create here. Olympia Snowe of Maine, the most important vote in the history of the world, apparently, today calling the bill a first step, but adding that a number of issues still need to be addressed. Mike Enzi of Wyoming saying in a statement, quote, "The proposal released today still spends too much and it does too little to cut health care costs for those with health insurance." Democrats on the committee not liking it much better than that, including, obviously, the lack of the public option.
There's got to be some discipline to other insurance companies that make them take seriously, not just competing with each other, but competing with somebody who, because they're nonprofit and don't have, a marble headquarters and don't have to report to Wall Street and don't have to please their shareholders because they don't have any, they can offer premiums at lower prices. Now, will that mean they put the private insurance industry out of business? Of course it doesn't.
The bill pleasing no one but the insurance companies. They rallied today on Wall Street after Chairman Baucus revealed his bill. HealthNet up 3%, United Health Group 2.7%, Humana 2.6%, WellPoint 1.7%, Aetna 1.6%. Baucus himself apparently not aware of the provisions in his own bill.
Millions of Americans today simply cannot afford quality health insurance. That's why it's time to act. And that's why this is our moment in history. This is our chance to reform health care in America. Our mark ensures choice and competition in the health insurance market, so every American can find quality, affordable coverage that cannot be taken away.
Taken away? The price will be taken out of your paycheck.